First of all, I'd like to thank Sajas for the invitation. I'm glad to be here in this grand debate. And I will talk about biology is not the major driver of a suboptimal response to bariatric surgery. I have nothing to disclose. And as you know, bariatric surgery is the best tool to treat clinically severe obesity. Bariatric surgery also presents a metabolic effect, and this metabolic effect is also known as a BRAVE effect when we talk about the renal gastric bypass. And BRAVE is the abbreviation of bioflow alteration, reduction of gastric size, anatomical rearrangement, and altered flow of nutrients, vagal manipulation, and enteric gut hormone modulation. All of these effects, these changes are going to lead to weight loss and will present some metabolic effects. And we also know that we have different procedures that will lead to different metabolic effects, and it will lead to weight loss. And we know that the big majority of patients will lose a big quantity of weight in the first year post-operatively, and they will keep their weight off in a long term. However, near 20% of patients will present a weight regain or insufficient weight loss. And as the possible main causes for that, we have some biological factors that are non-modifiable factors, such as hormone changes, metabolic effects, surgery-related issues, and we have some modifiable factors that healthcare professional can deal with. My presentation will be focused on modifiable factors. This recent paper found that there are 4 important modifiable factors that can interfere in the weight regain. They are dietary non-adherence, behavior and psychological issues, lack of support, and physical inactivity. And I will talk about each of these variables. Non-adherence to diet, it can occur even after bariatric surgery, even with all of the metabolic effects. Patients can present some habits can interfere in their weight loss. These habits are such as snacking over time, regular ingestion of liquids with calorie, regular consumption of ultra-processed foods that can change the microbiota, regular intake of alcohol, high carbohydrate intake, low protein intake, and loss of control eating. A recent paper that came from Lab's study with more than 1,400 patients found that some loss of control eating following bariatric surgery can occur in up to 50% of patients, and they can lose the control about their hunger if they eat more calories per day and more snacks per day, more meals per day, if they eat when they are not hungry. So this highlights the importance of the good guidance that patients will need after bariatric surgery. Behavior and psychological issues are related to self-monitoring and self-esteem. The literature have shown that patients that have good self-esteem will present better weight loss. And self-monitoring is another important point, because patients that are able to self-monitoring themselves, they will go better, they will have better weight loss. And this means that patients are supposed to self-weight regularly, such as weekly, see the healthcare professional regularly, to keep a food diary, to fulfill something, telling what they are eating, for them to know how many calories, how much protein they are eating, and to see or to go to exercises or to see a personal training regularly. These habits can interfere in the weight loss, and patients that are able to self-monitoring themselves, they have a better weight loss after bariatric surgery. The support, the cornerstone of support is to have an adequate support. And this means that they should have a social and familiar support, and also professionals, healthcare professionals that are specialized in bariatric surgery. Physical inactivity is another point that is very important. It is not as easy as people think, like you do more exercises and you're gonna spend more calories and you're gonna weight loss. Physical activity is more than that, is deeper than that. So patients that do exercises regularly, they have more muscle mass and they will have increased basal metabolic rate. And by the other way, patients that do not do exercises, they can lose muscle mass and have lower basal metabolic rate, which can interfere in the weight loss. A recent systematic review found that the eagerness to change physical activity after bariatric surgery had a correlation with better weight loss. Other papers also have shown that more than 300 minutes per week to 500 minutes per week can prevent weight and treat weight regain after bariatric surgery. So it is not as easy as tell the patient to walk 30 minutes 3 times per week. It is much than that. Keeping the muscle mass also includes the orientation of adequate amount of protein. Nutritional deficiencies also can interfere. This paper have shown that patients that presented low levels of ferritin, they presented the weight regain, and it can have a correlation with eating habits. Factors that have a correlation with weight loss or weight regain was studied in this systematic review, and they found some modifiable factors that had a correlation with positive correlation with weight regain, such as anxiety, sweet consumption, emotional eating, portion size, food urges and binge eating, loss of control or disinhibition when eating. And some habits had a negative correlation with weight regain. It means that they protected patients from weight regain, such as eagerness to change physical activity habits, self-esteem, social support, fruit consumption, zinc consumption, and quality of life. These other recent papers have shown that the patient's habit can interfere in the weight loss and weight regain. In the first year, most of patients, they lose the big majority of their weight. And before 1 year, the habits are going to interfere. We have one group that had weight regain, another one that didn't have. So the difference was in the habits. So patients that presented a poor diet, a higher energy intake, a higher fat percentage, a lower protein intake, a higher appetite ratings presented the weight regain. By the other way, patients that presented a higher quality diet, a lower energy intake, a lower fat percentage, a higher protein intake, patients that learned how to adapt to a new eating behaviors presented weight loss and didn't present weight regain, showing the importance of the good information and the healthcare professional to be aware about their know how to deal with these habits after bariatric surgery. Besides everything that happens after bariatric surgery, the microbiota changes and also the decrease in levels of hunger, patients are feel less rewarded with high caloric food. Sometimes we will need the help of some doctor, of some medication to help patients to adhere to the diet. So the recent studies have shown that medication can amplify the effect, the metabolic effect of bariatric surgery. And they are safe and we can use. As a conclusion, biology is an important factor in maintaining healthy weight. Modifiable factors should be understood and accompanied by healthcare professionals. The key point is for healthcare professional to provide clear information and for the patient to comply to the orientation given. Renowned institutions provide a multidisciplinary approach offering guidance to obtain success to maintain healthy weight. That's why I believe that good information, healthcare professionals specialized can help patients to deal with the modifiable factors. Thank you.